will do that all for us. Right, here we go. Afternoon, everyone, and welcome to today's meet and greet webinar. I'm Isabel van der Heeren. I'm the lead for transformation. Just checking that everyone can hear me okay and can see the slides. If you can just go into the question and answer section of this webinar and just say hello and just confirm that you can hear me and see me okay, and that you can see the slides. That would be wonderful before we start. Okay, somebody's already saying they're on. If somebody can just confirm, people can just confirm that, yeah. So people are saying you can see, hear me and see the slides okay. So that's brilliant. So like I said, welcome to another Meet and Connect webinar. Today we are joined by Laura Millard, who is part of the school nursing service, and she will be explaining all about school nursing, what they deliver, how people can access their support. Just for people who haven't joined us before or you're still new to this, so the Meet and Connect webinars or kind of Connect sessions are an opportunity to put some services in the spotlight. You are able to interact with us today by putting any questions or any comments in the question section, and then we'll pick them up at the end with Laura. So any questions you have, type them in, and then Laura will answer them for you at the end of the session. We are recording this session, so if you've got colleagues that haven't been able to join us today but you think this information would be really useful for them, then you'll be able to access them through the Safeguarding Partnership webinar. No need for you to make any notes from the slides today, as we will be sending straight after this session all the PowerPoint slides and the link to where you can access the webinar from today again. So we will be sending that out to you today. And like I said, if you've got any questions, then again, please type them in for you and we will pick them up at the end. So yeah, so welcome to today. And so without further ado, I would like to introduce to you Laura Millard, who will be doing today's session. Welcome, Laura.
Hello, thank you. So yeah, I was to say, my name's Laura Millard. There is two other team leaders within the service as well. So you might have heard of Trafine Molyneux and Samira Masood. So you could contact those as well. Can go to the first slide, please. Okay, so first things first, what is a school nurse? So I'd first like to explain that we're not the normally the older lady that sits within the school as the first aid. We are actually all registered nurses, so we're governed by the Nursing Midwifery Council, and we have to obviously feed back to them if there's any problems. School nurses have actually done some additional training either at a graduate level or a postgraduate level, and then they become public health nurses. Within the course, when we do that, we learn lots of additional skills and knowledge across different childhood topics such as emotional health and wellbeing, sexual health, medical needs, anything and everything to do with children's health and wealth and development. The school nurses within Walsall are actually based at Harden Health Centre. There's a big skill mix within the team and we couldn't do our jobs without them all. So we've got nursery nurses, staff nurses, clinical support workers, and our admin and clerical staff as well. We'll go to the next page, please. So some of the benefits of working with a school nursing service. So we work best in coordination with lots of other services and agencies. We work mostly with education, health and social care on a daily basis. But at the heart of all of the work that we do is the children, young people and their families. And we obviously listen to their needs and what they want from us as well. So obviously working in collaboration with us, we hope to obviously increase the academic progress and attainment of children and young people, increase their attendance at school, increase their behaviour, obviously support with any emotional health and wellbeing problems they have, and support with troubled families as well. The next slide, please. So although we're registered nurses, we follow the Healthy Child programme, and we are the lead for this, and we obviously deliver from within that programme. So we ensure that children and young people get the support that they need throughout their childhood life, so from 5 to 19 when they're in school, and support them at the earliest point possible through their transition. We deliver through the high impact areas, which I'm not sure whether you can see very well, but there are lots of key areas that government feel that we need to be addressing to support these children and young people through their early life. Have the next page, please. So we offer a core offer, which is universal to all children within Walsall. If they attend a Walsall school, they can access a school nursing service. So every school within Walsall does have a named school nurse, and we liaise with them throughout the year to be able to support them as best we can. So in the autumn term, we go and have a meeting with a key member within the school, whether that be a safeguarding teacher or SENDI lead, anybody that the school identifies is the best person to have this meeting with. And we kind of update them if there's been any changes for school nursing throughout the year, and then start planning for the rest of the year. So we offer things like assemblies for the secondary school pupils, and these mostly advertise our services to them, promote us and say who we are and what we can do to support them through their secondary school life. In the spring term, we kind of look at doing some parent information sessions around a health topic that the school identify they need support with. So that could be emotional health, behaviour, bedwetting, anything like that we can support them with. And then in the summer term is when we start looking at our transition, and we'll offer parent sessions to support the parents in helping their children to transition to secondary school, and then also the children as well. Throughout obviously what's been happening at the moment, we've done a lot of these sessions virtually, and they've worked really well. We also offer a central core offer, so these are accessed from within Harden Health Centre, and they cover an array of parent workshops, which the list is there, but it's forever growing as well. We add things to it. We have specific SENDI workshops to support families with things around behaviour, emotional health and fussy eating that are a little bit more specific to children with additional needs. We offer our parent programmes, so we've got Signet, Triple P, Understanding Your Child, and Adult Resilience as well. And then the children's programmes, so the Friends programme, which runs from 5 up until when they're teens as well. And we also offer the primary anger management. We also run a lot of teacher and staff training, so we run the medical needs, supporting to deliver RSE and mental health as well. Have the next slide, please. So to make a referral to us, parents can actually refer to us. It doesn't need to be a professional. Parents can phone us up, make a referral, and then we'll process it from there. The best referrals that we do get are from professionals, because obviously we have that additional information. So you can make a referral by either giving us a call on our duty number, which will be later on in the slide, or by completing one of the referral forms and emailing it to us. It does say post on there, but we would prefer email because we're moving to a more electronic system. The referral form is quite lengthy, but it does ask a lot of relevant questions, which will enable us to process the referral and get the children the best support that they need. So there's a section within there that we ask about what interventions have been delivered previously, if anything, and the impact of those. And that is a really important question, because that helps us to make any judgments of where we need to process that referral to. Have the next slide, please. So this slide is a little bit busy, but hopefully when it's sent out to you, you'll be able to see it a bit better. It just goes over our pathway. So I'm trying to think which colour is best to start at. So the green section, which is on the right hand side at the top, this talks about our single point of access. So when you make a referral, everything comes through our single point of access, and then we filter those referrals to where they need to go to first. So if a young person has never been accessed a school nursing service before, more often than not, they'll attend one of our workshops first. And that'll be one of the parent workshops, such as understanding your child's behaviour, understanding your child's emotions. There's enuresis, continence, lots of different ones that we can filter them through to. Obviously, once they've completed a workshop, they've had the first line information, they can then access our parent groups and our children's groups for that further support and information. Then we kind of ask them to implement any strategies that they've been given at those workshops and kind of see how it goes, not come back to us straight away. But obviously if problems persist or they escalate, they're more than welcome to come back to us and say, look, this is what I've done, I need to move on to the next part of the pathway. A lot of the time that would then mean a health assessment with one of our school nurses or one of our staff nurses, and that often is to just gather a lot of information and bring everything together. And this is when we'd be looking to get things like school reports, if they're open at early help, any information from there, and just gathering everything together so we can make a better holistic assessment of that child's needs and see where they need to go next. Obviously there's other situations that may arise, so we may have a referral in and there's a lot of red flags within that, and obviously we can address those problems straight away. So we do have the school nursing single point of access, and there's a nurse on duty every day. So if anything comes in and there's concerns around self-harm, for example, we'll contact the family straight away and give them that information that they need, and then process that referral to where it needs to go. And we do have access to positive steps cams, the paediatric panel, and obviously other health agencies as well. Obviously we have a pathway if children are open to early help and any other strand of children's services. So obviously child protection will become involved with child in need and early help. Obviously child protection, we become involved at the conference and then offer a health assessment from there. Child in need and early help, often we ask parents to opt into our service, obviously as it's voluntary, and then we'll obviously give the information and services as we need to there as well. So you can have a good look through that. Obviously if there's any questions about the pathway, you're free to give us a call and ask anything as well. Have the next slide please. So we obviously also work in partnership with the localities. Before coronavirus hit, we were well established within the hubs, and we were there either a Wednesday or a Thursday morning offering support and advice to the teams there about how they could then support the children and young people they were working with if they've got any health needs. So hopefully we can pick that back up soon once everything's a little bit more stable. We also offer a traded service offer to schools, so that obviously they can access our core offer for free, but this is more of a top up to support them within their school. So if they've got additional problems going on at that time, we can support them and offer any training or support systems to the parents as well. The next slide please. Okay, so this is an important slide, how to access us. So it's got our number, which is on there, and that will be manned by one of our nurses between 9 and 5 Monday to Friday. We've also got 2 chat health texting numbers, so again they're manned between 9 and 5 each day. So we've got the teen chat health and the parent chat health, and anybody can text us on those and ask any questions around health, and it's anonymous. Obviously that's the sort of thing we would promote at the autumn term assemblies to the secondary school, to get the teenagers to try and text us any problems that they've got, which it works really well. We've also got 2 websites, so there's Health for Teens and Health for Kids, and they were created by Leicester with children and young people, so the information, how it's set up and everything is really directed towards them. They're really lovely websites to have a look at. Each one does have a parent section as well, so obviously parents can go on, although it's directed towards the children, the parents can have a look at the information, so then they can have that conversation with children and young people and have the right information for them as well. So obviously there's further information on our corporate website as well, which is on there. Have the next slide, please. So that's a whistle-stop tour of school nursing. Is there any questions or comments at all?
Thank you, Laura, for that. At the moment, there's no questions that have come in during your presentation, so either it's really clear and people haven't got any questions. I guess my comment is that because of the term school nursing, people are outside school are not always aware about what you deliver and how people can access it. So I guess you talked about the parents can directly access your service, which is really important. So anybody working with children, young people and parents can kind of encourage parents to get directly in touch with your service. But also if you're a social worker or an early help worker, I guess you can also refer on behalf of a parent, which you know, kind of gets a bit of confusion around the school, you know, the term school nursing. So that's a really important part, that you are available, you know, you deliver a direct service to children, young people and families, and anybody who works with children, young people and families can refer to your service.
Yeah, okay.
Yeah. So what people are saying, it was really clear, so no questions. So I would encourage that people who, you know, kind of are interested in the programs kind of have a further look on the website, which has got really helpful information onto it, and the link to the website is in the PowerPoint, and that people connect with you if they've got any other questions about specific children and young people, because you are very you are experts in what you deliver, and you deliver very valuable service to children, young people and families. So I'm just going to have a quick look. So Lorna's just posted all of the information to where you can find the webinar, so you can re-listen to it. So thank you, Laura, for a really straightforward, clear and concise input on your service. We will be looking at the school at the health visiting service on Wednesday, so we'll be joined by 2 members of the health visiting service. So if you're not signed up, then you can sign up through the link. The one thing that we would like people to do once they've left the webinar is to complete our evaluation form, just to let us know how you found it, if you found the information useful, what else we can do to improve these Meet and Connect sessions. So we really would like to have your input into this. So I'm just having a final look to see if there's any further questions. People are saying thank you for the information, Laura, and they will share with the team. So yeah, thank you for making the time today. Very helpful session. Thank you for everybody who joined us, and see you hopefully all on Wednesday. Thank you. Bye.
Bye.